Hi, everyone. Thank you so much for joining us to our special series, Talking Mental Health, which I'm curating on behalf of the Health Collective for Roli Pulse, which is Roli Books' digital initiative. We're very, very happy here today because, joining us is the wonderful Varkha Chulani, clinical psychologist and psychotherapist at Lilavati Hospital in Mumbai. And Varkha, you're also associate fellow and supervisor at the Albert Ellis Institute of New York City. Thanks so much for taking the time to join us today.
Thank you so much, Amrita, for trusting me to be on your platform. And thank you, Roli Books, for putting this out. I hope it makes a huge difference to mental health and to what people are looking to do in terms of getting better and better as this pandemic plays out.
Yeah, absolutely, Varkha. And, just to give some context, so the Health Collective is a site I set up about 4 years ago. For those of you who aren't, across some of our work, I'd love for you to check it out. Varkha is one of the first psychologists actually who helped us think through how to demystify many topics to do with mental health. So I'll always appreciate that, Varkha, even when we're a small, blip on the radar. And you've always been able to, explain things in a more colloquial and conversational way, which I think is really what's required right now. And today, of course, we'll be talking about therapy and trying to demystify therapy. So let me start by asking you, why do you think that's important? I mean, what's some of the context you can bring to this from your experience, especially in India? Why is it important to demystify therapy?
So I think, first of all, the Indian lay public, including sometimes, professional degree holders and engineers, lawyers, sometimes even doctors themselves, find it very hard to distinguish between psychiatry and psychotherapy. There is utter confusion whether one should seek a psychiatrist first or one should seek a psychologist or a psychotherapist. They usually are looked at synonymously, which is actually not true at all. And I think it's important to know that psychiatry is the medical model of treatment and psychotherapy is more likely an educational model of treatment where we re-educate attitudes. So there are two reasons usually people would find themselves struggling a bit in the mental realm. One would be an actual chemical dysfunction. Now, we also fail to recognize as a lay audience that the endocrine system plays an extremely important part in the mental wellness of a person. So you've got hormones, you've got different kinds of chemicals combining together to sometimes cause dysfunction in the mind. At the end of the day, the brain is the center for everything. So we have to marry neurology, biology, psychiatry, psychology, psychotherapy to actually get a correct diagnosis as to why someone may be having certain emotional difficulties which are coming in the way of his or her living. The psychiatrist believes in the medical model of treatment, and a qualified therapist would believe in the educational model of treatment. The reason being is that when you have emotional distress due to chemical imbalances, endocrine dysfunctions in the body, which are more physiological, then you need to seek a psychiatrist or an endocrinologist or sometimes a neurologist, where all three will work in tandem together to address the reason for emotional distress, which is largely physiological. A good therapist has to make a distinction when someone walks into his or her clinic to be able to first ascertain whether the cause of distress, emotional distress, is neurological, physiological, endocrinological, or chemical, and then only enter into the realm of, there may be an attitudinal dysfunction. That means certain ideologies, philosophies, attitudes of life learned in the growing years or just picked up, on his or her own, which is the basis for the trouble. So it is very important to understand that there's a big distinction between psychology, psychotherapy, and psychiatry. They both follow very different models and they don't overlap. I'm not allowed as a therapist, for example, to prescribe any medication. Likewise, most psychiatrists are not trained in the therapeutic models that there are 330 schools of therapy, Amrita. And they just double up as therapists. That's another matter. But they are not trained also to do correct. Correct means they do not specialize in any system of therapy. And so they do what is advice giving, they do nice comment talk, which a friend can talk to me really, and that is unfortunately taken ahead as therapy. So it's important for us to know that you need to first reach out to a clinical psychologist. Then a clinical psychologist will make a correct diagnosis as to what possibly is the cause of the emotional distress that you're experiencing. Once he or she is able to make a correct diagnosis, if they are also trained in psychotherapy and they believe the problem is largely attitudinal and has no physiological basis, then therapy begins. If they feel no, it's not largely attitudinal and they need a referral, then they usually would refer to a psychiatrist or a neurologist or an endocrinologist to rule out any physiological dysfunctions that the body may be throwing up, as a result of which emotional distress may be accruing. And then the patient comes back or the client comes back to them, and then they either refer to a therapist or they start therapy themselves. So I think it's very important to know that.
So and what you've touched upon is so clear, because there's still so much confusion. You're right. When we decide, and this brings me to my second question, and maybe you can help us clarify. Suppose we decide that I need help. One, how do I know whether I need therapy? What should my first step be? And I'm actually asking this as someone, as you know, like many of us who are even educated lay people or think we know, still face these questions ourselves. And also people keep asking us, who do I go to? Where should I take my pen?
What is therapy? So we are very clear that every human being has some intelligence of his past and life experiences. And unfortunately, in spite of experience of life and some level of intelligence, is not able to do what he or she wants to do. Why? Because emotions block him. So therapy is releasing emotional blocks so that people can reach their potentiality. And if today I feel that I'm stagnating, I don't have to be mentally ill to go to a therapist. I just have to feel I want to do much better in life. Like today, I consider myself relatively fit, but I still go to yoga, I still go to the gym, I still work out because I'd like to be fitter. Therapy is not only for the ill. Therapy is also for increasing functionality, potentiality, exploiting what one's talents and abilities are. So anybody who wants to do better in life ought to seek therapy. It's like today, I want to be fitter. I seek a nutritionist. I go get a proper diet, which makes me even healthier than what I currently am. So I think another aspect of demystifying therapy is not only for the ill. In fact, I always tell my friends that people who want to do better will come to me, not because they're depressed, not because they're anxious. They just feel that there are some emotional blocks which are coming in the way. For example, they fear failure. For example, they're afraid of taking risk. For example, they feel that relationships are stagnating. They're not really thriving, whether in their marriages or within their sexual encounters with their partners. So therapy is just releasing emotional blocks. So if you feel you can do much better in life, please see a therapist. If you feel that you stagnated and reached a kind of a plateau, please see a therapist. It is not only people who are depressed, anxious, feeling guilt, or feelings of inadequacy, self-hatred, or self-harm sometimes that need to go seek help. So that's another concept. I have always sold therapy as wellness. It is not overcoming illness. It is always trying to be better and better than what you currently are. So it is a gap between where you are and where you want to be, which therapy would fill, which help a therapist, a good one, would help you to fill.
So let me ask you, as you qualified a good one, and I know we had these conversations in the past as well. I've read your columns. We have an issue in India, I think, many issues, of course, including lack of awareness, which we're trying to address through these kind of conversations. But when somebody asks you, who should I go to? There's only so many people I can refer, let's say by word of mouth, which I know a lot of your clients also do. How do we, and there's so many unfortunate stories also you hear, right? They've gone to the wrong person. It was a very bad experience. There doesn't seem to be some sort of certification we can take for granted in India, right? And I know you've also spoken about being a bit wary of people who are just, say, life coaches or taking people down that other path. How would you advise anyone watching you today, suppose they do want to take that first step, how would you advise them to go about learning first and then who to go to?
See, I think hopefully our hospitals in the country would be recruiting people with qualifications. I don't think a hospital would take a risk of putting someone as a consultant over there if the person was not qualified. So I think the best place to start would be with a hospital. The reason being is that the very fact that the person is empaneled as a therapist, as a psychologist, in a hospital setting, that means he or she has obviously met certain pretty stringent criteria to be there, right? So I would say always start with a hospital, because as you rightly said, there's no certification. People are doing some 2-year coaching, counseling, all kinds of courses with no real background as such, and calling themselves counselors or whatever. So I think a good starting point would be a medical institution which is recognized all over the country, to see who are they impaneling, or who do they have as consultants with them, and I think start with them. And of course, then, as I said, see, therapy is an art. It's based on science, but it's an art at the end of the day. You have to get along, connect to your therapist, and be able to see that there is value in one is qualification, absolutely, but the other is also personality, ability to relate, empathy, connection. So it's not really only the qualification. Of course, that's a prerequisite and that's a given, and I would not like to compromise any in any way on that. But then after that, your therapist and you have to get along. You have to build a working relationship. There has to be an acceptance. Both the therapist has to also accept the client. At the end of the day, therapist is as human as any. He or she will have his or her own biases, right? So the therapist has to be comfortable. The client has to be comfortable, and it has to be a two-way kind of a street. So word of mouth referrals, I think, are I would believe the most reliable, because if you like what I've done, say for example with you, but naturally you will recommend someone to come see me, and that's how usually practice builds, and people trust, and there is credibility to the person that is usually seeking a therapist out. The therapist has a credible reputation, so to speak.
Right. So let me bring in a question. Jagriti, who actually hosted one of these conversations, is a wonderful journalist. Two-part question she's tweeted us. One, when one starts therapy, how long should one expect the process to be until complete or reasonable recovery? And the second part, I'll just ask you after you answer this one.
Yeah. So, well, it's like driving, right? Some people take 10 lessons, some people take 20, and some people can learn in one. As a professional therapist, I was always trained in the idea that expect your client to come to you exactly once and never come again. So you need to finish what you need to finish quickly in 30 minutes or 45 minutes. That's usually what my session times are. Giving him or her something that when he or she leaves your office, they have got some value add and may choose never to come back. So not necessary therapy is a long drawn process, because as I repeat, there are different schools of therapy. So psychoanalysis, which is Freudian, will take you 30 years. What I specialize in, which is rational emotive behavior therapy or cognitive behavior therapy, kind of, is very quick. It's problem oriented, solution based, because we do believe that even though your past may have had some influence on you, it is your current attitude which you continue to subscribe to and believe which is coming in your way. So it is not necessary that you have to go through 1 year of therapy. You can get one session if the therapist is good enough and leave with a certain thought which you have to kind of mull over and help yourself. So let me also explain. Everybody doesn't need therapy. Somebody can watch this, somebody can watch a movie, somebody can read a book, or somebody can just sit with his or her own thoughts and change instantly. So all we believe is that somehow or the other the person has to change his attitude. Now, whether he does it with a therapist, he does it through a movie, he watches a TV serial, he reads a book, or he just thinks himself out of his disturbance, is also good enough. The problem here, Amrita, is that we've never been taught thinking. In fact, what is my system of therapy telling you? In our system of therapy, we are taught that the reason we are disturbed is because we are not using science for human problems. We are not thinking like mathematicians, statisticians, experimenters. We are not using logic and thinking, the ability to think through our problems. Because as I said in the beginning, we believe a person has the capacity to solve his or her problems. Emotions block him. Why do emotions block him? Because he or she is subscribing to a very faulty philosophy of life, as a result of which he or she feels anxious, depressed, guilty, jealous, hateful, etc., which are the most likely emotions that usually block us and come in our way. right?
So this is
So
for, you're saying the majority of people, not people who have, say, a diagnosis or something, right? You would say
yeah,
most
but
people.
most people, but again, diagnosis is more or less a label to understand the personality type, which may need some kind of medical support, okay, or is going to need much more intense sessions with a guided therapist simply because he or she is not capable of thinking his or her a way out of his or her own problems.
So just one, to be devil's advocate here, because for some of the people who've been sharing their first-person stories, they feel a lot of the times the onus is put on them, right? And then one of the myths they come up with is, friends and family might be well-meaning, but they'll say, why can't you just snap out of it or think your way out of it? How does this square with that experience where they absolutely feel either the medication that's been prescribed to them or they need, like you said, guided therapeutic sessions, and one will not maybe do the trick?
So it's because the parents and well-meaning family members haven't understood that unfortunately the person has not learned methodologies and ways of, one, understanding his or her reasons for dysfunction or distress, and two, needs to relearn, unlearn the aspects of things which he or she has picked up. So it's like teaching. Am I expected to know science if I haven't gone to school or gone to college? Right? So it is teaching. In, as I say, I call myself an educator. I educate in philosophies of living, not because I say they are the correct philosophies, but there is a certain system of therapy. So all therapy has a clear-cut theory. And if I know my theory, then I'm an educator. I will teach you. I will teach you. So please, Jagruti needs to ask herself that whenever she's gone to a therapist, she must answer one question. What did she learn in the therapy process on the day she sat with her therapist? Therapy is not talking. Therapy is not venting. Therapy is not advice giving. Therapy is just not letting off steam. Therapy is going back with something learned in the process of those 45 minutes or 1 hour that she would have spent with her therapist. And if she gets nothing, then I'm answering her second question. Then she needs to review whether her therapist is able to teach something which will be a takeaway. Because at the end of the day, we don't want our clients to be dependent on us. We want to empower them to stand on their own feet. How do we empower? By giving knowledge, by giving education, so that when later on life problems come, which they will, because of what they've learned, they're able to handle themselves rather than keep running to a therapist.
So thanks for bringing us back to that question. The second part was, if one relapses multiple times during medical treatment and therapy, does that mean something is not working, or is that part of the process? And of course, the disclaimers, we don't know exactly, the circumstances around which she's asking this question, but I'm sure that's something you would be facing a lot. People wondering about relapses, and then does it mean it's not working?
So there are many people who've taken medication and haven't improved at all, which only, in fact, some have worsened. Okay, which just indicates that it's not the chemical cause which is really causing the emotional distress, but more likely attitude. But let me also add, and I have made this mention, that today I think everything is being only focused on the mind. We are not looking at circumstantial environmental conditions which surround us. Like, say, for example, today the pandemic. There are actual people who have no money, who've lost their jobs, who have no way of generating income. Now, if they are getting anxious, it is not because of their mind that is causing the anxiety. They have actual unfortunate environmental conditions which are causing or triggering anxiety. Okay? Yes, if they were hopefully better equipped attitudinally, they would be able to manage their anxiety to try and go and solve what needs to be solved in terms of either skill up, go use networks, get jobs, do whatever it takes to at least get some semblance of normalcy back in their lives, okay, rather than be paralyzed by anxiety. So I would say that when a person relapses, we have to also pay close attention to the environmental factors which may be causing the relapse. Like, say, people in unfortunate marriages where there's emotional, physical, and sexual abuse, and they may go for therapy, but they come back to the same environment. Are you expecting them to not have a relapse? So we have to also take into consideration context, contextual factors. Everything is not because of my mind. And I think as therapists, we are paying too little attention to environmental factors. So Epictetus, the great philosopher, said, Situations in this world do not disturb us. It is our view. But to underscore only view and to completely eliminate. So we add situations contribute. They do not cause. They contribute. But how can I take away the contribution of a situation? So is my relapse happening because of a very, very difficult situation I'm constantly bombarded with? So I'm working with someone who's having very hard time with a very, very challenging and difficult boss. Every time she goes to work, there is animosity, there is hostility, there is vindictiveness. How can I say that all her anxiety is only coming because of her mind? There are people, toxicity at homes, in work arenas. I think they're very, very important to give due consideration to. So everything doesn't end and begin with your mind. And I think that's a bit unfair because then, you know why? The people who are actually seeking help feel even worse about themselves, that I should be fine and here I'm feeling very upset. And, you know, there's something even worse than wrong with me. I'm a gone case and I'm hopeless. So I think we're not giving enough attention to contextual factors or circumstances which are equally important in relapses.
That's really helpful, Varkha. Thank you for that. Let me ask you then, one thing that we're all living through, and as you pointed out, we might be very privileged in the way we're dealing with, what we're going through. And that's
extraordinarily privileged.
Extraordinary. And even, that has led people to, I've heard a lot of people presuming that, mental health and mental illness only affects either very privileged people or very underprivileged people. Everyone seems to think it's something for other people, right? It's important to have these conversations to realize, like you said, it affects every one of us, mental health, wellness, as we talk about it. But, right now, what we are all going through is this unprecedented pandemic. What are you seeing in your practice, and what would be some advice maybe if you had for people watching this? Because, we've had lockdown, we've had unlock 1.0, we've had states going back into lockdown. And through it all, as you pointed out, there's the work life has been hit, education has been hit. People are now pretty much families they're living with. Sometimes that's great, sometimes it's not so great, as we've seen in some comments. How are you seeing this? Are you seeing any kind of trends in sort of people reaching out to you? And what would you advise just to help build resilience where we can?
So I think first we have to be also honest with ourselves. I think personally, I just feel that sometimes that, constantly being kind of boxed in, of course, as I said, there is an extraordinary privilege. But at the same time, it's not a normal thing for us to constantly be feeling trapped or, kind of locked into homes. What we have to accept is that these are not natural circumstances. So giving ourselves the permission to experience sometimes irritability, sometimes a little bit of anxiety, a little bit of, sadness that, how long is this going to continue, or kind of a form of a hopelessness. I think the first thing that we have to accept is that we are also human and that we are going to go through this range of emotions. Let's not expect ourselves to feel happy all the time. I think a large part of emotional distress is also adding because we are all trying to be positive. We are all trying to only say that we are having the best time in the lockdown, and I think we're all fooling ourselves. So I think honesty with oneself is very, very important if one really needs to go. That yes, one will feel annoyed, one will feel irritable, one will feel unnecessary distress for no reason at all, and that's absolutely healthy to feel. Now, one doesn't have to get agitated with oneself for feeling it. That's one. I think interpersonal relations are being tested severely. I have never seen so much of distress between couples, between families. In fact, as you may have also read, the National Commission for Women reported in the first month of the lockdown itself that child abuse and women abuse had increased significantly because of the lockdown. Because the interpersonal relationships, I don't think are doing well. They were never doing well. I think 90% of India stays married because it has to and not because it wants to. And the interpersonal conflicts just gave an impetus was created because of the lockdown to just like blow up and be in your face all the time. Because we are in restricted environment. We live in small apartments where there are 5 people like literally jostling for space. There is the stress because there's financial burdens, people are leveraged, there are EMIs to pay, there are jobs lost, etc. So I think what one needs to do is understand and accept that these are very trying times, and make an attempt to collaborate and cooperate with each other, rather than each one trying to force his or her way down the other person's throat. So I think another thing that has really unfortunately created a lot of turmoil is that people have been rigid, stubborn, holding their ground, and not really trying to make an environment which is already fraught with distress. They're making it worse because they're not really getting along with each other. So I think a large part of focus, because I think this is going to go on at least till the end of the year, right? A large part of the focus ought to be, how do we make lives better for ourselves and for another? Because I will use, I think it was Rockefeller who said, the person who gets along gets ahead. I think we have to take a you approach. What can I do for you? How can I help you? I think we have to get out of our narcissistic, self-absorbed, self kind of constantly centric ideologies and look to making a difference to the people that we are living with, so that these next few months, which also will possibly be born in a more restrictive atmosphere, is better kind of lived. So I think it's important for us to cooperate, collaborate, and accept that we are going through a very, very difficult and a very challenging time. We may have all the money in the world, we may have all the privileges, but well, emotions are emotions, and these are not natural circumstances for human beings to live in. So I think accepting the reality and then doing whatever is within one's capacity to go out and make life easier for another person. I think this is the time to help one another.
That's amazing. Yeah. And you're as outspoken as ever. I think calling out our self-absorption. I think, let me ask you one thing though. I mean, I think that as we wind down, I think we're running out of time, but it's important for us to, as you said, think about what we can do for other people. You're definitely not in this fake it till you make it school of thought. I can see where we're all trying to show that we're doing better than we are. So honesty is super important. I do want to ask you one thing, Varkha, that has come up. People are, once they decide, and we're talking again about therapy and demystifying therapy, once people realize that, look, I could do, I might want to talk to someone. And nowadays, like I was asking you as well, you're also doing virtual sessions. I think that's become a very common thing. Pricing becomes a point that comes up often, for young adults, for folks who've been sort of laid off, but even otherwise. Pricing is one of those things where the more senior you get, of course, if you're in private practice, you can charge whatever you want to charge. But some people as clients or who are interested seem to get burned by this, right? What are your thoughts on pricing? What do you think is fair? And do you think that there are any options for folks who are feeling the sort of economic pinch, and maybe that's impeding them from trying to get help?
I would hope that medical insurance also covers therapy.
It's supposed to be under the new, I think under the new guidelines from last year or so, right? It was supposed to cover.
It's supposed to, but I don't think it has yet.
I'm not sure it's kicked in, yeah.
No. And also what happens is, so there are two aspects. Private practice is much more expensive because we are hiring clinics, paying rents, etc. But OPD practice is usually far more reasonable and affordable because the hospital picks up the bill of infrastructure and everything. So if a person really wants therapy for a long drawn period of time and cannot unfortunately afford it, it is important that they take OPD sessions. But then what happens, it becomes a catch-22. Like an OPD session, if I'm there on a Monday morning between 10 and 12, for example, now you or whoever wants to come and see me will have to cut work and then come because that's his or her work time. So it is a very, very difficult time. Economically, good therapy is expensive. It is. I mean, I'm not taking that away. And as I said, I'm only hoping that medical insurance covers it. But again, there comes a question. How much of India is really medically insured? That's the whole thing, right? So maybe foundations which kind of generate kind of funds, whether it's crowdfunding or it's just generally foundations which are giving therapy, impaneling therapists and giving therapy free of cost. So as a corporate social responsibility, maybe what corporates need to do, and I believe some are doing it, they have what we call EAP, Employee Assistance Programs, where they have therapists. I was a therapist available for one of the corporates a couple of years ago, where I was available every Friday in the office premises. And anybody from the office would just need to take an appointment and come and see me for free of cost. The corporate would pay me. So I think if corporates take on that as something that they want to give back, at least corporate India would have some kind of reach to a qualified professional who's on board in the premises once a week, twice a week, whatever is manageable, and gets it. And for the rest, as I repeat, hospital OPD therapy sessions are not as expensive as private sessions.
Okay, so we'll continue this conversation hopefully offline as well. I'm going to continue to send questions to you as we have for the last 4 years, Varkha. But last thoughts for anyone watching, if you had one piece of advice for anyone watching who's interested in this or is wondering why should we be even talking about mental health or demystifying therapy, what would your parting words of wisdom be?
So at the end of the day, I think one has to understand that the mind is a jewelry box. It's not a waste paper basket. And I hope that every one of us have a purpose. And I believe at least my purpose is to have an enjoyable life. I want to live a life which is healthy and which is enjoyable. And if every time I'm running into things which are unnecessary, aggravating me, and you are not being able to get the life that you desire, I think that itself should ask you to hit the pause button, to sit with yourself and to ask that why do I exist? I exist because I mean, since I've decided not to end my life, how do I make my life more enjoyable to me? And if all the time I'm wound up, I'm irritable, I'm constantly, kind of wired to not get along with people who I love, my family, my friends, my partner, my children, etc. What is this kind of life that I'm living? So I think we need to hit the pause button, and maybe the pandemic in one way has done a very good thing for us. It has helped us to pause, to recalibrate what really matters at this point. I mean, if you see all the restaurants, everything else is closed and we are sitting with ourselves, I think it's very important for us to face our own demons. I think it's very important for us to face our own thoughts. And at the end of the day, there are no rights or wrongs. Everyone decides for himself or herself what kind of a life he or she would like to construct. And I would say a purposeful living, whatever that purpose is, you have to decide for yourself how you want to get it. And if you're not being able to get it, sit back and ask, what is it that you are doing which is not allowing you to get it? So I'll end with a quote. My teacher, Dr. Albert Ellis, who I studied rational emotive behavior therapy from, when I was reading one of his books, I literally fell off my chair because he said something. When you find yourself in a problem, be sure you are part of the problem.
Oh dear. Now I have to sit and think about that one, don't I? That's a really interesting perspective. I think we were going on the optimistic, hopeful, inspiring thing until you hit that, and now we have to think about it. That's definitely food for thought. Varkha, thank you so much for joining us for this time, for sharing from your expertise, and of course trying to make this more conversational and understandable. It's really important what you're doing, and really appreciate your taking the time for this.
Pleasure as always. Thank you, Amrita, for giving me the opportunity with the Health Collective and with Roli Books. It's a pleasure.
And thanks so much to those of you who have been watching. You can always, send us your comments, send us your questions. You can check out our Understanding Therapy series on the website healthcollective.in. Thanks so much to all of you for watching. Thanks, Roli, as well for this initiative.